Welcome back, dental assistants, to Lecture 12, Endodontics. Endodontics is more commonly referred to as root canal therapy. This specialty focuses on the diagnosis and treatment of the tooth pulp and periapical tissues. Indications that endodontic treatment is needed, or when a root canal is recommended, are these: gross inflammation, a tooth that is necrotic or death to the cells of the tooth, a tooth that can be restored after a root canal is completed can have root canal treatment. If there is carious, mechanical, or traumatic exposure to the dental pulp. When a root canal is not recommended, meaning when a root canal should not be done to save the tooth, is when there is excessive loss of tooth structure due to trauma, excessive loss of tooth structure due to decay, mispositioned teeth, and lack of sufficient periodontal support, meaning excessive bone loss. What are the patient's symptoms when they need root canals? Often there is spontaneous or intermittent pain. There can be very severe pain. There can also be lingering pain to sweets and thermal sensitivity. Pain or swelling to palpation or pushing or tapping, pain to percussion or mastication. There can also be an absence of pain, but you will also see swelling. Radiolucent presentation at the apex of the apices will be seen in a radiograph often. In the clinical exam, the doctor will likely palpate the tooth with light pressure applied to the suspected offending tooth and surrounding tissues. They will often check for thermal sensitivity, which is the reaction to hot and cold, and they will check the tooth for any sensitivity. They will often use transillumination, especially on anterior teeth, which can be a light that's used to place on the lingual surface to see the translucency compared to the adjacent teeth. Sometimes they will use selective anesthesia, which means when an offending tooth cannot be isolated, anesthesia can be used to determine which tooth is exhibiting the symptoms. Usually in maxillary teeth, because individual teeth can be anesthetized. Sometimes we will find mobility or excessive mobility, which can indicate a large infection or lack of sufficient periodontal support. The doctor may use an electronic pulp tester. It's used to assess the vitality of a tooth. A slight electrical current is applied to the tooth to help determine the pathology. The use of a dental dam in root canals. Dental dams help to improve the visibility, decrease moisture contamination, which is extremely important, prevent caustic irrigants from entering the oral cavity. It prevents accidental inhalation or swallowing of small instruments. The types of endodontic treatment. Vital pulp capping. This is a method used to stimulate dental formation. Indirect pulp caps are when there is a chance of nerve exposure, and a small amount of carious tissue can sometimes be left with a calcium hydroxide placed over the top of that area closest to the nerve, and then a permanent restoration or temporary restoration can be placed. Direct pulp caps are when the nerve exposure occurs during an operative procedure. Calcium hydroxide is again placed over that exposure, and sometimes a temporary restoration is placed. The tooth is then monitored, and if it remains asymptomatic, a permanent restoration can be placed. A pulpotomy is an endodontic procedure used in deciduous teeth. It's the removal of that coronal chamber, leaving the pulp within the canals of the tooth. In primary teeth, the pulp chamber is removed and a hemostatic agent is placed on the pulp stumps for several minutes, and then the restoration is placed. In permanent teeth, this procedure is completed on permanent teeth that have not fully developed. So the pulp chamber is removed and the pulp within the canals is often left. The ultimate goal is to get secondary dentin to form to completely close the apex of that tooth. Apexogenesis is the process of performing a pulpotomy on an adult tooth with the goal of apex formation. Pulpectomy is also known as root canal treatment on deciduous teeth. This procedure involves removing the entire pulp from the deciduous tooth. It's accomplished by using very specialized instruments designed to navigate the very narrow pulp canals. Debridement is the removal of necrotic or diseased pulpal tissues. Apicoectomy is the procedure that involves removal of the apical portion of a tooth and the surrounding tissues. Curettage is the scraping and cleansing out of a diseased and infected tissue using a surgical instrument. Retrograde root canal procedure. A restoration is placed at the apex of a tooth following an apicoectomy.